Welcome to the Weird Works podcast. I'm Dr. Christy, your host. Join us for conversations about alternative and sometimes controversial healthcare topics. This podcast will provide the evidence that you need in order to make informed decisions about your health, to empower you with the facts that you need to advocate for your health, and to encourage you that there is hope your body heals. Join us from experts from all things weird, as well as the testimonies of people with stories of radical healing who were once told that perhaps their condition was a death sentence, that they would just need to live with it, or that drugs and invasive surgery were the only answer. Let's get into agreement that if there is something natural and non-invasive that could be helpful, that it could be your first option rather than your last resort.
Hey everybody, it's Dr. Christy here today on the Weird Works podcast, and I am joined with Dr. Michael Longyear. He is a chiropractor and a functional neurologist, and I'm going to let him explain that. But the reason why I had him on the podcast today is because, like a lot of healers and people that are really passionate about alternative type fields, I find that a lot of us have had our own personal story, and so I think his story is one of radical healing, and then of course a little weird and blue mixed in. So why don't you just kind of tell us, what do you do? What is functional neurology?
I always joke with people when I say functional neurology is we just get to play with people's brains. But I'm a chiropractor first, and I went to chiropractic school, and chiropractic is functional neurology in a little bit of a way. But if you think about it, what it really comes down to it, your brain has three jobs. And you have to perceive the world around you. So you got all these receptors like in your eyes, and you got touch receptors in your fingers, and you've even got receptors in your gut and things like that to process foods and things in different ways. And you have to take all that information in, so perceive your environment. You've got to process all of that information. And then after you process that and you understand things, you form a reaction to it. So if you have a disease process or anything starting to break down, you can have a breakdown in any one of those parts of your brain or your nervous system. And what functional neurology does is it's a lens with which we can view where the breakdown is. Is it in a perception or how you're feeling the world? Is it a breakdown in how you're processing all that information? Or is it a breakdown in movements or how you're reacting to your environment? And then what we can do is through the science of neuroplasticity, which is kind of a big word, but basically just means the brain's ability to rewire itself. Through different therapies and different very specific exercises, we can rewire the brain to make a change in those functions. So we often say we take someone that has lost function and we can restore them back to either their previous level of function or sometimes even a little bit better. So the short version of that is we can rewire the brain to improve health and function.
So that's pretty cool, because I feel like that contradicts what a lot of patients come in understanding about the nerves. Aren't a lot of people traditionally told that the nervous system doesn't heal?
Yeah, so a lot of people get diagnoses, and especially like when they come to us, we usually see people, I know you get the same thing. Yeah. People walk in with their grocery bag of medical records, and the doctor said, this is as good as I get, so is there anything you can do? And traditionally, we thought that nerves didn't heal at all, and then we just said, well, peripheral nerves, or the nerves that run to your muscles and your skin, heal, but the central nervous system, the brain and the spinal cord, that one doesn't. Right. Until people that couldn't walk were able to walk again. And now we kind of understand that the brain does heal to a certain extent, but what's really, really cool about it is the brain doesn't even have to heal, like regrow the same pathway. Your brain can be rewired to take over function. So, for instance, we've worked with a lot of traumatic brain injury patients, and we had a kid who had a stroke on the left side of his brain. And the left side of the brain is, especially the front part where his stroke was, is where speech comes from. It's also where your fine motor comes from to be able to move your hands. That area was damaged, and to be honest, it was damaged beyond repair. But with neuroplasticity, or the understanding that your brain can be rewired, other parts of your brain can actually pick that function up. So like in his case, we were able to reteach him how to use fine motor and reteach him how to speak again, just simply by activating that area, other areas of the brain to take over that function.
That's what's so important for people to hear is these incredible stories of healing, and that's really a big reason for the podcast, because once you start to understand neurology and anatomy and these different scientific fields, it becomes a lot more hopeful for people who are having some kind of chronic illness or have been given a diagnosis or told perhaps that this is as good as it's ever going to get. So why don't you kind of tell us how you learned about the field, because he has his own incredible story.
Well, so it can be a long story or a short story. I'll try to keep it fairly brief. When I was in high school, I was injured playing football, and I was going to catch a pass, and I got hit on one shoulder by one player and another shoulder by the other player, and kind of twisted down to the ground. And over the course of a couple days, I had inflammation kind of set up in my spine, and the game was on a Thursday night. I woke up Saturday morning, and I couldn't feel or move anything from about the nipple line down. And it freaked me out, obviously, as a 15-year-old kid. And they ended up, again, long story short, ended up in one hospital. And actually the hospital I had been to the night before, because I had some difficulty breathing, they diagnosed me with a pulled muscle and an out-of-place rib, sent me home with a muscle relaxer and a pain med, and said, you'll be fine in the morning. And clearly I wasn't. So I ended up there about 8 hours. They ran all sorts of tests, couldn't figure anything out. And I lived in a small town. So they sent me an hour north to a bigger hospital, and they did more testing and determined it was a spinal cord lesion. And originally they diagnosed me with a spinal stroke. And after, a whole day of testing, the neurologist kind of walked in my room. And again, I'm 15 years old. I was playing football 3 days prior to this. Walked in my room, looked at the chart that was on the end of my bed, kind of read it really quick, looked up at me and said, you had a spinal infarct, which means you had bleeding in your spine. You'll never walk again. Wow. Set my chart on the end of the bed and walked out. Great bedside manner, by the way.
Sounds very compassionate.
Yeah, for sure. Very cold, very sterile, and just kind of matter of fact. So when they first put me in physical therapy, they stuck me with an intern. She was there getting hours for finishing up her program. And the idea for PT was, we're going to teach you how to use this wheelchair. The shiny new wheels are your new ride, and we need to make sure you're proficient in it. So they kind of stuck me with an intern, and I think it was the best thing they could have done for me, to be honest, because I told her, when I'll do whatever you need to train me how to use the wheelchair. I get it. I can do this pretty easy. If I fall over, I'll figure out how to get back in. But I'm walking out of here. And at 15, it was maybe arrogance, maybe ignorance. And she kind of looked at me a little crazy, but she said, if you can walk 3 tiles, and they had this walker that was kind of in the corner. She said, if you can walk 3 tiles, and everybody knows those like standard 12-inch white shiny tiles that they have in PT bays or in hospitals in general. She said, we'll do a little bit each day to work on your leg strength. So the walker was this little blue hydraulic thing, and they rolled it up to my chair underneath my arms, and she pumped me up out of the chair, and I dragged my feet for 3 steps. I think it was a good thing I was playing football 3 days before. I dragged my feet for 3 steps, and she's like, okay, you lived up to your end. So she kept working with me a little bit each time on like strengthening and things. And after a couple of weeks, I was like the new toy, because my legs started to get stronger. I was able to do things that they said I'd never be able to do, and every physical therapist wanted to work with me. And I ended up walking out of the hospital about a month later. And I had deficits. I had a lot of deficits. I couldn't feel really well still from here down. I had no pain and temperature perception. I had no pain perception. And I use this to explain to people, one of the amazing things about the brain is, even though I didn't have the ability to feel pain, my body still had to know what had happened, because pain is just a symptom that something's going on, right?
Right, it's like that red flag call to action kind of thing.
Yeah, and often it's your brain's way of saying, hey, stop what it is you're doing. We got to kind of reevaluate what's going on here. So I didn't have the ability through the spinal cord damage to feel the pain. But if I stubbed my toe, and I learned this at like 2 o'clock in the morning one night, very hard. I got out of bed and I stubbed my toe, and I went to go step on my foot, and I didn't realize I'd kicked anything because I couldn't feel the pain, but I lost control of that leg, and I fell to the ground. And I'm like, what is going on here? And I got up, and I went to stand on my foot again, and I crumbled to the ground again. And I looked at my toe, and it was bleeding, and I'm like, oh, I kicked something. And So I didn't have the ability to perceive the pain, but my brain had shut the function off so that I literally couldn't keep walking until I assessed what was going on.
Yeah, it's a protective mechanism.
Yeah, so it was kind of cool to see that, and that's neuroplasticity at work, really, in that, I didn't have the ability to perceive the pain, but my brain still knows that that was an important signal to pay attention to. So, and that's one way that your brain protects you that can be used in the same way to help heal you. So I went through life for a year of not being able to perceive pain or cold or hot for temperature. And one day I went to the chiropractor. My brother kind of talked me into going to this guy.
That's how it usually happens, right?
Yeah, he's like, I got adjusted and I feel great. Maybe he'll help you. And I just had back pain from having, the muscle issues and all physical therapy.
Right.
And, being told your spine was bleeding and you were never going to walk again, I was a little bit apprehensive about getting cracked.
Yeah, cracked.
Yeah,
Back then, that's what you thought, right?
Great, I'm going to be back in the hospital. Hopefully they saved my bed kind of thing, right? But I went there, and he was an old school chiro, the guy that kind of picks you up and rattles you out.
Yeah,
basically just
bone
cracked everything.
crunchers.
Yeah, cracked everything. Not super specific, but it was actually turned out being super effective. I went to him, and he adjusted everything. Like, I'm pretty sure my ears were adjusted, my teeth, he cracked those a couple times. And I went home, and I was running a shower, and I put my foot in to see, to kind of step in, and I was like, oh crap, that's too hot. And I reflexively pulled my foot out of the shower, and then it kind of hit me all at once. I'm like, wait a minute, that was too hot. And
you felt it.
Yeah, I dipped my toe in there again and pulled it back out. It was like a new toy. I was like, I can feel temperature again.
That's pretty cool.
And so I went to him the next day, and I was like, Doc, I don't know what you did, but can you? And he had no idea. He's like,
yeah.
Power that made the body heals the body, and you're healing from the inside out. And that's 15 years old, 16 at this point. It went completely over my head.
Right.
But when I got to chiropractic school, they teach you this kind of bone on a nerve thing. And I heard the original chiropractic story about a guy who had his hearing restored, and then my story, and I'm putting the pieces together, and I was like, wait a minute, so did he move all the bones off all the nerves, and what nerve is it that runs from the neck to the ear and does anything with hearing? And it just didn't make sense to me. So I started studying neurology and kind of realizing how we can make changes in the brain to restore function and hearing. For me, it was cold and hot and pain, and for other people, it's hearing. For other people, it's different things. So I say I took the blue pill, so to speak, and went all the way down the rabbit hole and to the neurology side of things.
So did you always have that inquisitive type of mind? Because it sounds like at 15 years old, a lot of people would have just taken what the doctor told them at that point as gospel, and never questioned it, and, maybe did some PT and got mildly better, or, somewhat improvement so they could live their lives, but, you took it to the next degree. So was that just something in your determination? Is that just how your brain is wired? What do you think it was?
I think so. I'll always just kind of ask the next question, right? If somebody tells me something, okay, then why? I was that annoying kid.
Yeah.
Hey, Dad, why is the sky blue? Well, because it's blue. But why? I was always kind of asking that. Always scientific in a way and trying to discover things. But, I don't ever take anyone's word as gospel. I think I want to find out, I got to fact check them, right? In today's world of fake news, I fact check everything if somebody tells me something. So yeah, I think it's important to always ask. And, I finally, when I got into chiropractic, I understood, this doc walked in, he was very cold, delivered the diagnosis, and that I was just supposed to accept that.
Right.
And I think healthcare today is more of a team. I'm part of your team. I'm going to give you what my thoughts and opinions are.
Correct.
And I think that's a piece of the puzzle for you. And then there's other pieces of the puzzle that can get added in there and can do some things with you.
Right.
So.
I like that. It's true, because there's plenty of research actually that shows that the people who get the best outcomes are the ones who usually combine traditional and alternative medicine. And so, a lot of people think oh, you're just way over here on this side of things, and it's not really true. There's a right time and place for both. Just we do happen to believe that oftentimes the most extreme invasive is all too often the first call to action instead of the last resort. So do you kind of feel the same way?
Yeah, I always tell my friends, if I'm bleeding profusely, don't take me to a chiropractor.
Right.
Take me to the emergency room. At that point, I'm good going to the hospital. And they do what they do. They do really well. Emergency medicine kind of stuff is really good. But, when you look at the drugs and the things that are created for a lot of what I've referred to as chronic conditions,
Right.
let's say blood pressure, for instance. Most blood pressure meds, especially the beta blockers, when they were created, it was intended to be on them for 6 months to a year
Right.
while you made the necessary health changes in your life to then get off of the drugs. You were never meant to be, even the drug companies, never meant for you to be on beta blockers for the rest of your life or even after 12 months. So, again, there's interventional, and I think sometimes, a drug or a chemical is necessary to get you through something, but then it's about lifestyle change, and it's about owning your health and taking those things back over. And I think that's where we kind of got lost in the shuffle, is that people got that and they were like, okay, that's the easy button. I'll just take that forever. But the drug is really just getting rid of the symptom while your system kind of erodes underneath it. And they're not really willing to sometimes do those other things.
Right. And so that kind of leads me to the next question is, what is the difference between the chiropractic functional neurology and traditional neurology? And is it really just about that, like continuing to ask the question why and get more to the root cause?
Yeah, so I always kind of explain it is the difference between pathology and physiology.
Right.
And, medical doctors are really good at looking for a pathology, meaning, they're really good at looking at an MRI scan and saying, is something growing here that shouldn't be growing? Is something bleeding that shouldn't be? Is something missing that should be there? Where they don't do a real good job is looking at disorders of physiology. For instance, concussion gets a lot of play out there. And we had a kid come to us one time, he was a 16-year-old boy, and he had actually been cleared to play football because he didn't have headaches anymore and he didn't have dizziness and all the symptoms went away. Yet he was failing out of school. He went from being an A and B student to getting C's and D's. He had scholarships originally to play football, and they started pulling scholarships because of grades. And mom brought him in, not because of symptoms, right? He didn't have headaches. He didn't have any of those things. Mom brought him in because he was a jerk. That's literally what it said.
Wow.
He's not my kid anymore. He's rude to his brothers and sister. He's failing out of school. And so when we looked at him, we measured his eyes, and we look a lot at the eyes, but we look at him differently. So he was able to look left and he was able to look right, but when you watched him do it, instead of smoothly moving back and forth, it kind of looked like you were watching his eyes through a strobe light. And they were jumping like from target to target, even though the target was moving nice and slow. And we showed mom, I'm like, does that look normal to you? And she very quickly was like, no. Like, so he can look left, he can look right, but it's how well he does that. And that's where functional neurology, and really where I think healthcare, the more vitalistic or more holistic healthcare in general, looks at the function of you. Not is it pathological, is something missing or growing where it shouldn't be, but how well does your body function on a day-to-day basis, and how well can it get through certain tasks? Because that's really, if you can catch it there, that's when you can make the most change and the biggest changes. When they've got a tumor, it's, that's grown and taking up, a whole part of their body cavity, it's harder to make changes at that point. If you can catch it before the tumor gets to that point or before it even starts to grow, we can make a lot bigger changes.
And that makes sense, because I think anybody in, like holistic, chiropractic, alternative type therapies, that is the model, right? Be proactive, preventative thinking, get in there sooner than later when you have choices, right? When something, it's more likely early on that something natural and non-invasive is going to work for you, right?
Yeah. I had a patient put it really well to me one time. He said, I spent most of my younger days ignoring my health in search of money. And he basically ran himself into the ground. And he said, and now I'm spending all of my money trying to regain my health and get a couple more years with my grandkids and my family. So you pay for it on one end or the other, right?
True.
And if you set yourself up well in the beginning, you can enjoy those later years and that time with your grandkids like he was trying to search for, and in a much better way, rather than fighting off cancer or fighting off all of these other conditions that might pop up as a result.
I like the way he put that, because I've said that to patients, like, it's harder to realize that when you're not, you're going through life and you're being able to do what you can, your body will adapt for high levels of stress for a really long period of time until suddenly it won't. And like you think, you don't think of that you're living your entire working life, to spend the rest of your retirement years bouncing from doctor to doctor. But all too often that is the scene. And by the time people come to us, that's not what they worked so hard their whole entire life for. So it does really take a shift, like a paradigm shift in your thinking. Like you're going to take care of it now, or you're going to deal with the ramifications later. And it's going to take longer, and it's definitely going to cost you a lot more money in the long run. There's research on those numbers as well. So then who should see you? Like we talked about stroke, we talked about concussion. Does somebody necessarily have to have had an injury or have a diagnosis of some kind of chronic illness to benefit from what you do?
Yeah, so that's a good question. A lot of chronic illnesses can benefit, but we always joke and say anybody with a brain needs to see us.
True.
Right?
I'm a patient, so you can think whatever you think about my function, but it's necessary.
Well, we only get one. They haven't figured out how to do a brain transplant yet, and I'm sure they're working on it in some AI lab somewhere. Right. But we only get one brain, and we got to really kind of pay attention to it. And with our life, we're living longer. Well, until this recent understanding, this is the first generation that won't outlive their parents, actually. But we're living longer, so you see more of a breakdown in brain health and brain function as we age. And, we get the question a lot is, well, I'm just getting old, that's why my memory's going. Aging, the normal process of aging doesn't include memory loss. And you look at people like super agers, which is a population that they can study where we can actually measure function because they don't have a lot of these breakdowns because they haven't been exposed to a lot of things that, the toxins that maybe we have in America. And there's certain pockets in the area or in the country and in the world. If you look it up, it's called blue zones, where people don't seem to age on the same rate that we do in other parts of the world, or in most parts of the world, I should say. And so they measure those people, or they study those people. So memory loss isn't a normal part of aging. So if you're starting to forget names or forget things like that, or trouble coming up with words, get it now before it becomes pathology or becomes degenerative to the part. We do a neuro-fit class where exercise is awesome and exercise is phenomenal for the brain, and there's a stack of books that prove it and a stack of research articles that prove it. But I like to exercise not so much for my waistline, but for my brain. And oftentimes it doesn't include much different, like with our exercise programs, we will do the same stuff you'd see at a CrossFit gym sometimes, or we might go for a run. But we also add a cognitive component to it. So, while you're doing squats and lunges and burpees, I might have you, every time I clap, you gotta do 5 jumping jacks. Or if I hold up a red card, you gotta do squats. And if it's a black card, you gotta do push-ups. So you have to think through some of the exercises. So we can add very easily some brain exercise to regular exercise and focus it in a little bit more. Because I think it's important, sometimes, and you see this more than I do, sometimes people will eat for their waistline or not eat for their waistline, and they'll eat like low-fat foods or sugar-free things, and sometimes that might be okay for your waistline and it might get you to lose weight, but it's not the best thing for your health. So, when we look at it, we want to eat for our brains, not our waistlines, and your waistline will take care of itself if you're eating things that are good for your brain. So we want to focus more in on kind of better choices and growing in that way.
Yeah, I'm for all of that, but what I just heard you say in my crazy brain and the way my brain works is that I can multitask. I could be doing 2 things at once. I could exercise my muscles and my brain at the same time. That's awesome. I'm going to do that.
Yeah, we got to save time, right?
Yeah.
True multitasking doesn't actually happen, but we can add layers to things to make it better.
Yeah, he's trying to teach me that, and I've heard that. You don't multitask, you multi-fail. So you're in agreement with that?
That's a great way to say it.
Okay, that's a real thing. Yeah, I thought I was a really incredible person because I was always prided myself in the fact I could run circles around most people. I could probably accomplish 10 times the average person could by the end of the day. My husband would testify to that as well. But then I started studying, meditation and, this mindfulness, and I was like, maybe I'm driving myself bonkers. Maybe this isn't ideal. And so what he's saying is true.
Yeah, the old phrases like stop and smell the roses, or, take some me time, all of those things are very important for brain.
Right. And we're going to talk about stress in a minute, but, what I think he's going to prove to us is that when you are in a state of fight or flight or stress, it really is impossible for your brain to repair. And so most people probably never go into that repair phase for the majority of their day or week or month, right?
Yeah, do you think people are suffering with insomnia more than ever and lots of things? And that's really when the repair happens. If your brain is so wound up on what did I forget to do today or what do I have to do tomorrow, it's really hard to get into that repair phase.
Yeah, it makes sense. So is there kind of a list of conditions or people like maybe deficits that they could identify that they might search for somebody in their area, or if they're in Jacksonville, come and see you locally?
Yeah, so traumatic brain injury is the biggest one that we do really, really well with. Stroke rehabilitation is another really big one too, because a lot of times people just kind of get left with that. The old science of traumatic brain injury is sit in a dark room for 10 days, and what they've actually shown, and this was in 2016, every 4 years guidelines come out for concussion. 2020 has been delayed a little bit because of 2020. Just because. But in 2016, they actually reversed the thought of if you have a traumatic brain injury, sit in a dark room for 10 days, that's the best thing. They actually said that's bad for your brain, it's detrimental. What you really want to do is what we call sub-threshold exercises to rehab the brain during that time frame. But a lot of doctors don't know that, so a lot of them still get this, go sit in a dark room. Stroke is another one. Unfortunately, medical hospitals are a business, and they're very busy and they need beds. So especially with physical therapy, they have these parameters, and once you need a certain level of function, they kind of just move you through, right? And that level of function isn't necessarily where you were before you had the stroke. So what we really want to see is an improved function and continue to grow. So stroke, traumatic brain injury, another really big one that we've been seeing a lot of lately too is kids with developmental delays, and specifically kids that have dyslexia. And I say dyslexia because there's a misdiagnosis that's happening in the literature starting to pale it out in that they're diagnosing these kids with dyslexia, but it's not true dyslexia. It's what we refer to as a convergence insufficiency, meaning their eyes have trouble converging on a target or coming together to look at a word. So if the right eye doesn't move as well as the left eye, the right eye might see one part of a word or the second word, and the left eye might see the first word. And so these kids are flipping words and flipping letters. And it goes with poor posture. If your kid has like a head tilt or poor posture or rolling shoulders and is also struggling to learn to read or feels like, they're really having trouble with math, you can do a real quick test at home and just have them follow your thumb in as you come to their nose. And a lot of times you'll see one eye just kind of quit or dive out. And that's not dyslexia. That's a convergence insufficiency. And it's something through chiropractic adjustments as well as functional neurology, we can really work to improve that. And we just had a little girl this morning. We saw her 2 weeks ago, and Dad's a doctor, so we sent them home with a bunch of home exercises, and she came in today, and she was, she had one eye, like a lazy eye, right? And it just kind of quit and was all the way into the middle. And when she came in today, she looked me dead in the eye with both eyes, and it was a huge improvement. And they were happy with it as well. So she's not all the way there. One eye is still quitting, and we got a lot of work to do on her. But after 2 weeks of just doing some exercises, she's not falling. She's doing a lot better with a lot of things. So we see a lot of kids like that, unfortunately. The less kids are out playing and running and jumping, they're not driving those areas in their brain and their nervous system anymore. So, there's a lot more learning disabilities popping up, or, you see this side of it more than I do. They're eating fake foods, so there's a lot more chemical sensitivities on that end of things too.
Oh, yeah. Well, and like you said, they're not up and running and jumping and playing, so that the whole, they're on their phones and video games and, on their devices more than we were as kids. Our parents threw us outside and they were come home with dinners ready, right?
Yep. Yeah. Get home before the street lights. That was the only rule, right?
Yeah. So this is affecting their neurology and their development.
Yep, absolutely.
So that's some pretty cool stuff. So I've been to the office, like I mentioned, I'm a patient, and so when you go, I'm just going to set the stage, and then I'm going to let Dr. Mike tell you what a typical day is like in his office. But, you go in, and there's, flashing lights, and there's big screens. You get to, play video games while you're in there, and there's vibration plates that you stand on, and he might be throwing balls at you, and making you write backwards, and there's a tongue stimulator. So some wild blue stuff. So we got to get into the weird works part because that is the name of the podcast here. So what is a typical day like? Is that kind of a normal scene?
It is, yeah. We try to make it fun, right? Neuro rehab doesn't have to be, I know neuro kind of gets thrown into the category of nerdy or hard or things like that, but neuro rehab doesn't have to be boring. So we try to make it fun. We play a lot of catch in our office. You mentioned the tongue stim, and I always tell people I'm going to shock your tongue when you come in, and everybody thinks I'm kidding until I tell them to stick their tongue out. But the reason that we do it is, you kind of alluded to the fight or flight and rest and digest.
Yeah.
When you're under stress, we turn on a part of the nervous system called your fight or flight or sympathetic nervous system. And the other side of that is the gas, or the brake to that, right? The sympathetic is the gas, and then the brake is the parasympathetic nervous system, which is rest, digest, and rebuild. Well, in our society right now, we're kind of go, go, go all the time. Healthy body, healthy nervous system, healthy physiology is actually 80% parasympathetic, rest, digest, rebuild, and 20% sympathetic. We've kind of flipped that in our society. We definitely have gone more into this. So the tongue stim actually forces you into that parasympathetic nervous system. So when we put stimulation into the tongue, we put a pulse ox on people, and a pulse ox will tell us your oxygen saturation and your heart rate. And it's fun. I'll put the pulse ox on somebody, and then we'll shock their tongue, and you'll see their heart rate drop 5 to 10 points sometimes.
Yeah.
And that shows us that we're activating that parasympathetic nervous system. So we usually start with chiropractic adjustment to kind of clear the system so that your brain is talking to your body. And then we start with tongue stim to activate the parasympathetic nervous system so that you can rebuild and regenerate. And the other reason that we do that is when you're in stress or you're in fight or flight, two things happen with your blood supply and that make it hard to work on your body and your brain. One is you take blood from your gut and you send it out to your arms and your legs. And that's why people under chronic stress have a lot of gut dysfunction or a lot of leaky gut you'll hear, or they have a lot of stomach issues and they can't digest their food as well. Well, the opposite actually happens in the brain. And you drive blood from the outer part, which is what makes us more human, and you drive it inside to what we call the limbic brain, or what's known as lower parts of the brain. And that's responsible for more fear and survival and stress, right? So you literally take blood away from the part that allows you to connect to others and the rest of the world, and you drive it to the area where we're in fear or we're trying to just be safe. So we activate the tongue to start, because then that puts you into that rest and digest, which allows us to pull blood and resources and activation into those higher centers. And then we just go have fun. We literally play games.
That's what he says. You get out of the treatment room and he's like, okay, let's go have fun. And then you go into the little game center treatment facility.
And it's all, you've been there, it's all movement games.
Yeah.
So movement is life, right? So the more you move, the better your brain, and we move you a very specific way. So it looks like a lot of fun. We might just be playing catch with somebody, but when we're playing catch, all the throws might go up and to the left and down and to the right, because it'll activate a certain area of your neuraxis to drive into one side of your brain versus the other to help us kind of fix the balance in your brain and rewire it, so to speak.
Yeah. So you talked about the eye tracking a bunch, and I just want to, you said something pretty cool to me very early on when I was a patient, and you said, because everybody I think knows, we do muscle testing in the office. That's like our main way of getting access to the inside of the body, for the body to communicate to us that what's going on when you can't see it in traditional diagnostic imaging or x-rays or blood work. And so he said one day that our eyes, or the eyes of people, you'll explain it better than me, is really his version of the muscle test.
Yeah.
So what did you mean by that, and why the eyes?
Well, so I love muscle testing because it's a way for us to talk to the body. And the muscle test, when it goes weak, tells us about one area of the brain that coordinates things that might not be coordinating well, and that's our window in, right?
Yeah.
Well, I like to use the eyes, and we watch the pupils a lot. If you shine a light in someone's eye, the pupil should constrict. When you take the light away, the pupil gets bigger. When you're in fight or flight, or that sympathetic nervous system, your pupil gets bigger so you can take in all the light to take in everything to run away from the tiger, so to speak.
Right.
So when we're doing things, I use the eyes as the muscle test, It's the one cranial nerve, or it's the only part of your central nervous system that you can actually see. Everything else, your brain and your spinal cord, you don't actually get to look at. If you are looking at it, the person's probably not healthy, or they're on a table and wide open.
Something's cut open, right?
Yeah. So the eyes are our way to look directly at the central nervous system. We hear the eyes are the window to the soul, right? That's kind of the old saying. Well, they're also that picture, that direct picture of your central nervous system. So it gives me instant access to kind of where we're at on that level, where your energy level is in the brain, and how your function is going in the central nervous system.
So it kind of gives you a baseline, and then you can track somebody's progress or response to treatment by looking at it before and after.
Yeah, so another interesting story, we had a little guy in yesterday, and he's having a lot of mood issues, a lot of kind of acting out and very kind of angry a lot and very impulsive, lack of control, right? We see that a lot in kids when they don't develop well, and even in adults. One of the biggest signs of Alzheimer's is when your frontal lobe starts to break down, which is the hallmark of Alzheimer's, is that they start to get more angry, right? They lash out to their loved ones, and they're just not cool to be around anymore. So with him, what we saw as a lack of control is his pupils got huge, and you could barely see the color of his eyes. So when you shine a light in him, the pupil wouldn't constrict.
Wow.
So he didn't have that same ability. So we did some therapies with him, and we did some convergence exercises, actually, where I had him following some targets as they were coming near him, and we played catch. And then we looked at his eyes later, and he was actually sitting in calm instead of running all over the office like a madman. And I brought Mom over and I'm like, look, see, you can tell his eyes are brown again. They're not black. And he was actually sitting and chill. So it's a way to kind of tell of that function of where the brain is. If the pupils are really big, you want to stay away. Guys, if you're watching, or girls, if you go home and your wife's right pupil is really blown out, don't start an argument. You will lose, because that part of the brain isn't functioning well. The part of the brain that will have a logical conversation and understand your side of the story isn't functioning.
It's not on.
Yeah, so if the right pupil's big, just go in the garage, tinker with something, whatever you need to do, but don't have the argument at that point.
Or girls, if you want to win an argument, go to the mirror and see if your right pupil's big, and then you can go into it. Yeah, get into it.
Formulating the argument.
You got
all sorts of traps.
Okay, so you've talked about a bunch of different stories, which I thought were all amazing, especially with the kids, because what we've taught parents over and over again is children aren't trying to be misbehaved, and oftentimes what's sad to me is when the kids get started on the world of pharmaceuticals right away, and so, teachers are going to be sending letters home with these type of children with their behavioral stuff and not being able to focus or sit still or concentrate, or maybe they're just jerks like that one parent had described her child. But there's a reason behind it, and it's correctable, and otherwise these people don't end up coming into offices like mine or Dr. Mike's until maybe they're in their 30s or sometimes even 40s, when they're just have exhausted what the pharmaceuticals can do. They're tired of the side effects. They just don't feel like themselves anymore. The biggest complaint I get on those meds is they lose their personality because they're too muted down. And so we have the chance to reverse these children early so they don't become a consumer of the pharmaceutical world for the rest of their life, right?
Yeah.
It's pretty hopeful. But I wanted to give you an opportunity. What's your best case? What's the example of radical healing, meaning somebody who was given that death sentence or diagnosis, like yourself, told that they would never get better, that there wasn't anything maybe other than drugs or surgery, or just kind of live with it. What's your favorite story of radical healing that you've seen?
There's a couple, but the one that comes to mind was the one just most recently. There was a little girl that came to us, and it was a heart-wrenching story, and just kind of killed me at the beginning, and I was actually really mad at the way that she was handled. Yeah. But she was 8 years old, or is 8 years old, and when she was a baby, she was born to some parents that had drug abuse issues. And Mom, talking to the grandparents, when she was first born, they brought the baby into the hospital, and Mom, they said, Mom, you want to hold her? And she's like, no, give her to her dad. So right away, this kid never had connection. Mom left when she was 6 months old. Dad had her, but Dad had his own demons with drug abuse and things like that, and didn't ever take care of her. She would cry until Grandma and Grandpa would just kind of randomly show up at the house and help. And when she was 3 years old, finally, Dad left too, and Grandma and Grandpa ended up adopting her. And without that interaction, babies don't get touch or love or those kind of things. Her nervous system never really developed, and she's 8 and just unruly. You want to talk about getting notes? This girl was way past getting notes sent home. They were kicking her out of school. They actually put her in special school by the time we'd gotten to her, where she was in with all of these kids that had really, really bad dysfunctions and were beating up their siblings and trying to burn houses down and things like that, and it wasn't a good situation. So when she came to us, the other option was they were going to put her in foster care for 6 months with a behavioral therapist, which to me, the thought that was even a thought blows my mind. I'm like, you're going to take this kid who didn't get love and hugs.
Right.
She's finally connected to the grandparents who she knows as mom and dad.
Right.
And she's getting that love, and you're going to take that away now? You're going to destroy this kid's brain.
Right.
So they wanted to take her out of the house for 6 months to a year and do hardcore behavioral therapy. When they came down to us, we said, hey, listen, our approach is going to be totally different. We want you to put your hands on her. We want to exercise the part of the brain that controls it. When you talk about kids don't want to be bad, when you ask this little girl, when you act out, when you do these things that you're getting sent home from school for, do you feel bad? And you saw her face change. Like, she absolutely felt bad. She's like, I don't want to do it. I just can't help it. And, we started to work on that front part of the brain again. That's where the control comes from. That's part of what makes us human. But, this girl, when she was having these acting out, but the other biggest thing is she wouldn't sleep in her own bed. And it came out during the week of care that she was having nightmares of what Dad would do to her when she was younger, and I didn't ask or want to know what that was.
Right.
But she always slept with her grandparents, and she had for 5 years. So Grandma and Grandpa or Mom and Dad had never gotten to have their marriage either, because she was in bed with them all the time. So the goals were simple for her. We want her to be able to make it through a school day, and we want her to sleep on her own.
Right.
And by exercising that front part of the brain, we can work on the control of emotions and outbursts and those impulsivities. And we also work on that independence and wanting to be part of society and connect to others. And, we did a lot of work with her. We saw her only for a week, but we saw her 15 times in that week, 3 times a day for 5 days. And she went back home, and I talked to Grandma, Grandpa, Mom, and Dad 2 weeks later, and since she had been at our place, she hadn't gotten any marks on her letters to get sent home. And they bought her a tent for her bed, and she had slept in her bed almost every night since she left our office.
That's so awesome.
So they wanted to put her on all these, brain blunting drugs and just shut her nervous system down. And they wanted to take her out of the home, the family that she knew, and basically retrain her. We did that with our dogs. We sent them away for 2 weeks to a trainer, and they came back and they would sit. But I don't know that it's the best thing to do to a human being. So she was probably right now and again, it's because it's the most recent, one of my favorite stories, just because it was so heart-wrenching to hear at 8 years old everything she had been through.
Right.
But at 8 years old, how much she still had now to look forward to.
You think of a life of no hope, right? If she had just gone down that road, what kind of future did she really, what kind of opportunities did she really have, even if she did get on pharmaceuticals, career, pursuing any kind of higher purpose or ability to give back to community or have a family of her own, that's pretty devastating.
Yeah, those drugs, they blunt everything, especially creativity. So you lose that when you give these kids and you change that neurochemistry that early. You turn them into little robots, right? They will do a task just fine, and they'll stay on and they'll focus. Yeah. But they lose the creative part of their brain, and that's what I hate about the ADHD drugs is they turn that creativity off. And these parents, in an effort to get a kid to sit down in a classroom, which the brain was never really meant to do, you take away their ability to be creative and kind of their imagination, and we get away from that with kids, and that scares me a little bit about where we're going with that stuff.
Well, if they're losing their creativity and they're just numb so that they'll behave and be little robots and they're kind of controllable and easier to deal with in, a traditional school setting, which is some of the motivation behind that, if they're not being able to create and be playful and use imagination, then doesn't that throw all of neuroplasticity right out the window?
Yeah, it makes it a lot harder to rewire things, especially when, they kind of wire them into one side of their brain. It's really hard to then get them into that other side to be creative and fun and enjoy life.
So the traditional medical model is creating long-term neurological deficits.
I would agree with that statement.
I'm making him say that.
Yeah, we kind of, and we do, but if you look at everything in society, it's, you don't go to school to, and I'm not bashing teachers or anything like that, but the school systems, they're overrun. So what school teaches you is how to be a student and how to get a 9-to-5 job. It doesn't teach you creativity. If you look at some of the foremost thinkers, and I'm not saying drop out of school and go be a hippie or anything like that, please. But if you look at some of our foremost thinkers, they didn't go through the traditional school all the way through because they had that creativity. If you want to go way back in time, Leonardo da Vinci, he failed out of all school. He was thought to be, dumb and ignorant, and he's probably one of the greatest thinkers in history. Einstein, kind of the same thing, struggled with some basic things, but wrote the theory of relativity because he was able to expand his mind and do those things. So, if your kid is a little weird, that's a little good or a lot good because you don't want them to necessarily fit in the box all the time. I get it, they got to make it through school, but there's what's really cool right now is in schools they're doing these 501Es or EPs or whatever. You can have a trampoline in the back and let your kid bounce. You can have a ball for them to sit on instead of a chair. You can let them get up and walk around and experience the environment instead of being stuck in a desk staring at a screen. So they're willing to make those changes for you instead of drugging or medicating kids.
Yeah, I love that. Well, and I think we're going to see a difference now with the homeschool model because kids can sit on a ball or bounce around or get up or hit pause and move around and that kind of thing too. So it'll be interesting to see how that plays out. So I know this is more our field with the nutrition side of things, but is there anything specific that you tell people that they should eat for optimal brain health?
Well, so when we get people, a lot of times we see them interventionally, but we remove the big things. Now, there's a lot of diets out there, and that space can be very confusing. And there's keto, there's paleo, there's all of those types of things, and there's vegan, and there's this. I had our anatomy teacher in Chiro school was a vet, and his thing was pretty simple. He said, if you look at an animal's mouth, you can tell what it should eat. We have canines, but we only have 4 of them.
Right.
So when you look at a percentage, that's about 10 to 15%. So maybe 10 to 15% of our food should come from meat, and the rest should come from plants and things like that. So we kind of stick to that model. But there's 3 things that, especially in a brain injury or in a stroke patient, I just kind of blanketly remove. We remove gluten, dairy, and soy. And the reason being is they're just inflammatory. Gluten's not really gluten anymore. Again, you know this. You go way further with this than I do. Gluten's not gluten. We were never meant to drink another animal's milk. And soy has been basically overproduced so much that it's not really what the original plant was.
It's so processed and genetically modified.
Yeah,
right?
And it's pro-estrogenic, so you can throw hormone patterns off in males and females, and so we kind of ignore or eliminate those to start. And eliminate the inflammation. And we try to get people to eat a well-rounded diet. For general health, I really like the mind diet. Again, eating for your brain, not for your waistline, so to speak. And it's, the mind diet is a modified version of Mediterranean diet. So just with a little bit more healthy fats. But, if people have other issues, like a lot of gut dysfunction, we usually send them to somebody that can handle that a little more specifically.
Yeah. Okay, well that's helpful. We talked about stress, but I had a curveball question for you. It wasn't on the list of questions I sent him. Is it possible to get on somebody's last nerve? I mean, it's possible because people have gotten trampled all over my last nerve. Is there any neuro? Yeah. Smash it. Yeah, do the twist all over it.
It's possible, yeah. So again, when we drive all that blood and resources into the fear centers of the brain or those those limbic areas, you lose the ability to want to connect to society.
Okay.
So, and that's really what that last nerve is when you just are like done with people, right?
Yeah.
Or you're done with that certain person. You just kind of want to retreat away from everybody. That's that last nerve thing. And that's because we've become so limbic or so wound up into fear or anxiety that you just don't want to hear it anymore.
Yeah.
And that's happening a lot with people. You get a lot of people in the office that have been stuck inside with some person for so long. If you look at domestic abuse, unfortunately, divorce rates, all of those things are skyrocketing with all of this, isolation.
Yeah. Yeah, with the quarantine for sure. We have a tool called heart rate variability. I think you guys use something like that in your office as well. And on average during this time, even if people were doing self-care, eating right, staying on program, taking supplements, and doing seemingly all the right things, our measurement showed that everybody, on average, like a 5 to 10 year addition of stress in their body. So like if you're 30, you would be experiencing the stress of a 40-year-old, or if you're 50, the experience of a 60-year-old. So, taking 10 years longevity off your life because of what we all just went through as a culture in 2020 is pretty significant.
Yeah, absolutely.
That might be why I asked that question. Okay, here's another fun one. This probably could be a weekend seminar at least, but is there really a neurological difference between men and women? Are we really wired that differently?
We are, and it's funny. There's a couple things on that. There's a guy named Mark Gungor who does men's brains, women's brains, and he's a pastor. Dr. Hall, one of my mentors, turned me on to him, and he talks about how men's brains and women's brains are wired a little bit differently. But we also do, and it is a weekend seminar. It's called He Said, She Said, and it talks about the differences in brains and body. A female doesn't get the same exam that a male does in our office. There's differences. You guys bleed once a month, so you're anemic until proven otherwise. So we have to rule things like anemia out and the effect that has on brain health. The other thing is, and the University of Stanford actually did the research on this, there is differences in the male brain and the female brain. Sorry guys, but the female brain is bigger than the male brain is, but it doesn't mean it's smarter.
Oh,
it doesn't mean
I was already drawing that next conclusion.
Yeah, it's bigger, but the connections, the interesting part, the really interesting thing that came out of the University of Stanford study was that you've got two hemispheres or two sides to your brain, and females have more neurons connecting the two hemispheres than males do. And if you look at Gungor's stuff, he talks about how men are really good at doing one thing seemingly for hours without interruption, and women just can't do that, right?
And women are looking at the men like, hello, are you done with that? Can we move on?
Yep, yeah,
right?
Like, hurry up, let's move to the next thing.
Hello.
But women have a lot better connectivity from hemisphere to hemisphere. So when you talk to a guy, we're really good at speaking in data or one thing, and we can get really dry and drawn out in that way. And men are typically, they do a lot better with being by themselves and isolating, right? Guys are really good at going in the garage and tinkering with something. Females, it's more healthy for you guys to go for a walk and gab, right? Dr. Hall always says this muscle needs to move as much as these muscles do in females because you guys have to be able to talk it out. Guys have to maybe go by themselves and think about it, but it's because of that connectivity from hemisphere to hemisphere. You guys use both sides of your brain. You need that interaction to be able to talk it out and do that. So yes, there is a difference. And it makes a difference in how we get to health too, and in our stress relieving things. It is the worst thing to put a woman by herself. And meditation can be good, and don't get me wrong, mindfulness practices are good, but men can do that more often and more efficiently than the female brain can, where the female needs to go talk and kind of have it out, solve the world's problems, if you will.
Right, that makes sense. And with that, more connection between right and left brain, doesn't that also bring in, emotions tied to words and, the creative side and the, realistic, logical side?
Yep, very good. Yeah, it brings in the, girls speaking with more inflection and more emotion. So prosody or rhythm to our talk comes from the right side of our brain, and the data part kind of comes from the left. So that's why women will talk with a lot more emotion, and they're talking to a guy that's just hearing the words, right? So that's the, when we talk, we're giving you all the logic and all the facts, and you're taking it in and trying to figure out what it means emotionally because you're using both sides of your brain, which is why sometimes that communication between the male brain and the female brain, when that right pupil is really big, guys, remember, is not happening because you guys want to tie emotion to what we're logically saying, and then you turn around and say emotional things back to us, and we're still in that logic part going, well, where did that come from?
They're like, you're so dramatic, right? But we're like this connected to that, that. Like we had 25 thoughts before we like spit out what our response in words was to you, right?
Yep. Yeah, and Gungor goes into that. Everything's connected to everything. Your wife is connected to your job, and your job is connected to your mother, and your mother's connected to the kids, and in a guy that just doesn't happen. We're like, kids have their box, and job has this box, and we don't cross-talk all that well.
And I heard it explained, and I like this a lot, like men are like waffles, so all the little compartments, and you take one box off of the filing cabinet at a time, like off of the shelf, and then you open that box, and you deal with what's in that box. Then you have to like close it and put it back on the shelf before you go to the next box and open that. While women's like spaghetti, like what we just talked about, like everything's so intertangled and interconnected, and men are like, how did you go from there to there that quick,
And the guy's sitting there going, how did we get here? I just wanted to know what you wanted to get. Because it spirals. Everything's connected to everything.
I think we're going to save some marriages with this explanation. It is important, and it's really interesting to understand because you can't just force somebody to be like somebody else because neurologically we're very differently wired.
Yeah, absolutely.
So all we can do is try to understand. Okay, so I got asked this question a lot, and I'm always like, this is impossible to answer. People have asked me, like, if there was just one thing that people could do to improve their health with nutrition, what would it be? And then you're kind of like, one thing, somebody else? And my answer was sugar. We all could do better by eliminating sugar across the board, or all things that break down into sugar. So, what is the one thing that people can do to improve their neurology?
Well, so we talked already about movement, and I think movement is huge for the brain, and we absolutely need to do it. But again, I'm going to kind of bring it back to that blue zones and the highest concentration of 100-year-olds on the planet. And the one thing that they noticed that was different in those areas was social connectivity. So the one thing that I would say is be a part of your community. Go out and talk to people. And I know right now with what we're dealing with, it's hard to do that. But as soon as this is over, we need to get out and have the one-on-one interactions. It's not the same on a computer screen. It's a 2D experience versus a 4D experience. So our brains, different than other animals, we're wired to be communal. And what they noticed in the blue zones is that where people are healthier longer, they had better social connections. They still got together for Sunday dinners. They still, knew their neighbors. A lot of places in America, you might look at somebody that lives next door to you and you don't even recognize them, you don't even know them, right? You might not say hi to your neighbors. I live in a condo and I have neighbors that literally run when they see other people because they don't want to have to say hi or have a communication, right? So we need to stop that. We need to be more connected. There's some research right now that's come out in the last couple of years on Alzheimer's and Parkinson's again, because they expect Alzheimer's and Parkinson's to cripple our economy by 2050. Because we're living long enough, but now we're living with this degeneration, and we don't have a good way to take care of it. You're going to start seeing, or you already are seeing, like adult daycares and things like that.
Yeah.
But what they noticed was there's actually a magic number if you're over 60 years old of how many friends you need to have to decrease the likelihood that you will have neurodegeneration, and that magic number is 5. If people that have, through their adult life, 5 or more friends, they tend to have less neurodegeneration as they age. Now, I always get asked this question, well, does it count? Do Facebook friends count? Because I got like 2,000 of those.
No, they don't.
And the answer is absolutely not. That actually detracts. For every 1,000 Facebook friends, you need 1 extra friend.
Real life, in-person friends.
Yeah, because if you have 2,000 Facebook friends, you're spending too much time on Facebook. But I always say it like this. It's 5 people that you could call at 4 o'clock in the morning to come help you fix a flat tire that would actually show up. And the other question I always get is family count. And family doesn't either. This is people outside of that family circle, growing that sphere. Families just counted as they should always show up at that time, right? But for most families. But for we need to expand that sphere and have other people that we talk to. So 5 friends as we age that we can have communication with and talks with, that we can go, for the female, go for that long walk and solve the world's problems. For that male, maybe it's go throw some weights around the gym together or whatever, quietly or silently. And that would be the one thing, is that social connection.
That's cool. I didn't expect you to say that.
Yeah.
5 is manageable. Hear me as the multitasker. I'm like, can I manage 5 friends? 5 is doable. 5 is manageable. Let's say you said like 25, and I'd be like, oh man.
Yeah, that would be overwhelming.
Yeah.
That's acquaintances at that number.
Right. That's more like the Facebook friends. Okay. Well, so what's next for you? I know that you have a private practice here in Jax. I know that you teach as well. And I also know some of the things that are on the horizon for you. But what do you want our listeners to know? Where can they find you? What's coming up on your agenda?
Well, we have the office here, and then I also run a clinic in Atlanta that's affiliated with Life University, Neurology Institute there. And then I've started writing books. So I never intended to write books. My story just kind of, like a lot of people, or guys especially, we tend to bury our emotions. And one night at about 4 o'clock in the morning, it clawed its way out of me through tears, and I started writing and got to about 50,000 words, and was like, hey, maybe this could help somebody else. So I wrote a book, Never Accept Your New Normal, about, again, they told me I'd never walk again, and I want people to understand that a diagnosis isn't a death sentence, right?
Yep.
It's a thought, it's an opinion, and that's why you can go to another doctor and get a second opinion.
Yeah.
And that's what I did until I was happy with the opinion that kind of spoke to me, and I was able to leave and walk out of the hospital. So there's that book, and then there's another one coming called Medical Minimalist, how to decrease our reliance on deadly drugs and doctors and kind of regain our health. That is kind of in the works. So I'm writing with my wife, who who's going to offer, I'm the science side of things, and she's the woo-woo side. She's the really, crystals and energy healing, and so we're going to write a book together about kind of those 2 thought processes and those 2 sides to the story. About, getting rid of, my grandparents had 17 drugs in a bag.
Yeah, my grandma too. That was part of my motivation watching her. I was like, shoot, I'm not doing that.
Yeah, and so I take 0, and I have patients that are 56 years old that take 0, and that's definitely possible.
It is.
And I want to, kind of help guide people to get to that.
That's awesome. So when those books are available, we'll definitely add the links in the show notes and make sure that you guys can find them, because I think people need more stories like this just to know what's possible. I think in our world we have a lot higher hopes and higher expectations of what could be as far as your health and just life in general than maybe the traditional model will lead you to believe is that you're capable of. And so that's why we have this podcast. That's why we have amazing guests like Dr. Mike on that want to help you guys just know what your full potential is. So that's it for today. I'm signing off. This is Dr. Christy, and Good Health Naturally. Thanks for joining us.